Welcome back, everyone. This is Dennis Day with Getting Your Edge, How to Right Size Your Home and Life podcast. We've got a very informative show about Medicare. Before I get going, I want to introduce our co-host, Judygratton.
Hi, Dennis.
Hi. Our guest is Kevin Anderson, has been working Medicare for the past 12 years. Enrolled over 800 people. Kevin sets you apart from a regular Medicare agent. Much more informative and helpful than the 1-800 numbers. Kevin?
That's for sure.
Why,
Yeah.
Kevin? What's the difference between you and other brokers?
One of the key things this year, instead of being a captive agent for one company, we found it necessary to become brokers. I'm appointed with 5 companies in your area. I can write 38 plans. I'm not a captive, so we have the freedom to find the perfect plan. The most common thing I hear is, I want the same plan you gave my best friend. And I said, there's about a 1 in 25 chance to happen, but let me ask you some questions. We were on the best plan for him, but it wasn't the same as his friend. Being a broker gives us the freedom to find the best plan, make sure networks that are appropriate for the individual. And that's why I'm good at what I do.
Kevin has been our broker for 2 years, I think, or is it 3? This year, everything changed. I had Kevin up before. It's important for people to understand the changes this year and how it could affect. Mentioned me, Kevin, people who want to change plan. I want when they saw what it was, they didn't want it. That was me.
No, you weren't alone. I had a couple of those today.
What are the key changes from 2024 to 2025 in Medicare, and how will they impact seniors?
It is every Advantage plan, drug plan will cease to exist December 31st.
Wow.
Plans are being dissolved because of changes in Medicare. Many people won't be aware until January 1st that they've reverted back to simple A and B Medicare without a supplement or Advantage plan. Several companies have left many counties in Washington, well-known companies, will be leaving permanently starting in January. Let's see if I can do it in a nutshell without making 2-hour Medicare seminars.
Okay.
Because of counties, the big void. At least 2 companies have come into Washington for the first time. Other states, not only Washington, but in every single county. They're the only Medicare companies in every county. Brings challenges of establishing networks. Medicare is big in Oregon, but this is their first time in Washington. It's a scary thing. Big company leaving in Washington, 69,000 people will wake up January 1st without a plan if they didn't do anything. Those groups of people can't enroll in a plan. It's unfortunate, but I'll touch on more of this as we go.
Why were there changes in Medicare? What happened? And what are the goals intended to be achieved by these changes?
Judy, that's a deep question and gets to the heart of the matter. The big news is that the donut hole will cease to exist starting in January. Congress has been working on shrinking the donut hole to help seniors. In 2022, President Biden signed the Inflation Reduction Act, eliminating the donut hole. Huge. My wife and I both do Medicare, and we've had people with drug lists pay $28,000 a year. Is the record in the low $20,000. Once you and the plan paid $5,000, not counting premium, you go into the donut hole. 25% on a typical tier 3, the copayment might be $45. All of a sudden, they're $400 and $500 in the donut hole. Hoping to get out next year, once they've reached $2,000 in deductibles or copays, the rest of the year, I applaud President Biden. That's another change is payment plan for prescriptions. Starting in January, folks that spend $24,000 a year in drugs, that's $2,000 a month. After January, the drugs will be free after that, right? not very many of us can spend $2,000 in 1 month, right? We're on fixed budgets. Seniors have downsized. They've moved into, you guys know all about that more than I do. They're on a set budget. It doesn't grow unless you count little raises in their Social Security. They're on a fixed budget. How do you pay the $2,000? Medicare says, starting next year, what we'll do, because we know you won't have drug plan payments after this, we'll divide it into 12 months. They won't discount it. So instead of 2,000 in January, I don't know what 2,000 divided by 12 is. Judy's super good at math when she has a calculator in her hand. When she has a calculator in her hand,
Okay. Yes, I do. Right here. It's called my phone. I'll look.
it's going to be like $105 in January in each month, I'm guessing. But that's better than 2,000, and that's brand new, and that's from the Inflation Reduction Act. So those are good things. Now, one of the results of that is that drugs that
$166.66. There you go.
was $8.44. The whole thing is geared towards helping seniors lower the cost of their medication. And so that's a great thing. Would you like to know how the premiums and deductions and copays will change?
Absolutely. I've been waiting all day for this.
Medicare allows drug plans, standalone drug plans, or embedded in Advantage plans. They allow a $590 deductible. That's the max. Now, companies can go with less, but most of the drug plans are $500. If we're talking in the $37 to $48 range a month for a premium for a drug plan, they're going to have to pay the whole $590. Now, many companies that have Advantage plans with the drug plan built in, they said 90% of prescriptions are generic. Tiers 1 and 2, there are 5 tiers. Tiers 1 and 2 are generic. We won't apply a deductible to that. We'll just apply a deductible for tiers 3 and up. That's a huge help, right? And they might say, depending on the plan and depending on the company, instead of $590, we're only going to charge $250 deductible. So that's another good thing. It's making lemonade because it isn't such a great thing that people have to pay deductible where they never had to do that before. If you want a standalone drug plan without a deductible, the cheapest one that I know is $83 a month. And I haven't enrolled a single person in it. Now, many people have been mapped over to that by their companies because of the plan that they had that went away. The company is going to automatically put them in another drug plan. But the reason I don't like it, $83 a month, member premiums don't count towards your $2,000. So you get rid of the $590 deductible, you start just paying copays on your medications, but you don't get credit for that $83 or more a month. You don't get $1,000 credit towards a $2,000 max. Doesn't make any sense in my way of thinking. Now, in the past, it was important because you paid $100 a month or $110 a month for a premium for a drug plan, but then you had reasonable copays. Now, my own drug plan, I'm not on an Advantage plan. There aren't Advantage plans in the county that is now my permanent residence. Most overall, as a general term, there's no Advantage plans. So I have a standalone drug plan. Mine, if I kept that one, went up tenfold for January and included a $590 deductible. It went from $3.70 a month. Very few people know about that drug plan, but I have a great agent. My wife put me on that plan. And instead of $3.70 a month premium, they want you to pay $37 a month next year. That's tenfold.
Yeah.
Now, the other big change is many plans. I won't say a majority of them, but pretty close to at least half the plans now will have a medical deductible. That's brand new news to me. I haven't seen that before in the state of Washington. So before your zero copay for your physician visit, you've got to meet a $175 deductible or whatever the deductible is. Unfortunately, what the biggest company doesn't do that. They don't have a medical deductible. So those are some of the changes that we're going to see.
It could be really expensive if you're not careful.
It is. And we'll get it to the end on what people can do if they've made a mistake or they don't know how to fix it. Today is Wednesday. Medicare open annual enrollment ends Saturday at midnight. we're down to the last 3 days, Thursday, Friday, Saturday. And in years past, we've had appointments showing up at houses on December 7th at 11 p.m. Back then, Jen had to do the whole list, the cases one at a time. I forgot the question. Just to remind you, I have attention deficit disorder. So I go down rabbit trails and sometimes I don't make it back.
I think you have earned that, it sounds like, over the last few weeks, trying to help people understand what the best choice is for them. And I really, Kevin sat down with us with 3 different plans and explained the 3 that he saw for our particular needs. And then we made a decision based on that. But it took a lot of work. One of the things that I know it has changed dramatically is dental, which I'm very much a stickler about dental. And so Kevin had to go hunting to find something that worked for us with dental.
There's another challenge that doesn't affect very many people in your audience, but people that have Medicare and Medicaid, that whole arena, and that's outside the scope of this webinar, that whole arena is changing dramatically. Companies that one company has 8 dual plans, where before they just had 2, and they general and a PPO. Now they have 8. Now we have to determine eligibility, and then there's an integrated issue that's going to come up in the next few years, where the company that gives the dual plans has to be integrated with Medicaid and a contracted Medicaid so that they only get billed once. Doctors don't have to send part of the bill to one place and then the other part to Medicaid. So there's a same one in it. Thank you, Judy, for the compliment. I appreciate it.
Well, I'm very serious about that. And that's why I wanted to have you back on. So hopefully people hear this. Now, you mentioned something briefly about if they don't have an open enrollment period, but isn't there a period in the first part of the year where they can still make a change?
Yes. This started just a few years ago. It's called open enrollment period. People call the one we're in right now open, but it's annual enrollment period that goes through December 7th. AEP. OEP, you're right, Judy, starts January 1st and goes to the end of March. It's only for people with Advantage plans, and I'm glad Medicare started this a few years back. If you have an Advantage plan that you don't like, or you signed on to one because you watched the TV commercial or whatever, and you find out it's not what you were hoping for, in January and February and March, you can change to any other Advantage plan, guarantee issue, no waiting periods, no pre-existing conditions. And you can get the plan that's best for you. Now, that's really important in the companies that stayed. The companies that stayed have sent back in the first week in October, they sent annual notification of change letters to everyone. And it said, here's your plan for 2024. Here's the plan we're putting you in for 2025. If we're talking about United Healthcare, that's 20 new Advantage plans, 20 that they have for this year. And so a computer decided, you're on this certain PPO, we're going to put you on this other PPO. Yeah, your premium's going to jump to $46. It doesn't come with any dental anymore, or it might include just cleaning, something like that. And people go, oh, okay. And then I've been called so many times, just even today again. And I called and activated my new card, and I didn't have to come and see you. Should I cancel my appointment? No, you shouldn't. Let's have the appointment and let's see if that's the best plan for you. And in a very short order, we find out it's not. But that's perfect for those whose companies stayed, not like Regions that left, you have nothing, right? If that company stayed, whether it's Humana or United Healthcare, I won't mention a couple of the others because it's just better not to mention a couple others. I don't want to disparage anybody, but for those that stayed, they mapped over their client base to a new plan. Some companies call it crosswalked them over. So they won't be without coverage. And during OEP, we can change you. So that brings a lot of hope.
One point I want to make, because I don't think people understand this, but your services don't cost them anything.
No. And I had 10 appointments today. And twice I was asked this question. Judy just made a statement about, how much do we owe you? You just spent 2 hours with us. What do I have to pay you? No. And it doesn't matter if I enrolled you a premium of zero, a plan that costs nothing, or if I enrolled you in an F plan, a supplement that costs $330, doesn't matter. I get paid the same. The companies pay us. And the companies have that money because Medicare pays them to administer the plan. So yeah, it's free. And everyone should utilize an agent or a broker. It's very helpful. And they don't make more money recommending certain plans. Okay.
So can you going back to why did all these changes, like loss of dental and different things, why?
Okay. Simply, your drugs this year are free after you pay $8,000. Next year, they're free after $2,000. Companies have a $6,000 gap, right? Not everyone makes it into the normal, but lots more people are going to make the $2,000. So how do they build a plan? They have a certain amount of money from Medicare that they have to give back 85% in benefits. They're allowed 15% for expenses and employees and profit, ROI. So they have to make up $6,000. Now, some companies just stripped bare bones, the medical. Instead of $25 for a specialist, maybe it's $65, for example, right? Instead of $1,000 for dental, one company has $250. And not only is it $250 for dental, it's your total for dental and vision. So they stripped down to make up that $6,000 hole. Now, I don't mean to just talk about one plan, but the only company that illustrates what I'm trying to say the best is United Healthcare with 20 new plans. So they built a plan with certain kinds of frosting on the cake. The cake is the same size. Medicare is Medicare. Here's the thing. Maybe I want less cake and more frosting. Maybe I just want a bite of cake in the middle and lots of frosting, being the auxiliary benefits or alter therapies. Like some people are into naturopath and the acupuncture. Some people really enjoy chiropractor. Those are alternative therapies. There's only 3 plans in your county that includes those things. But then they might not have over the counter. They might not have glasses. Some don't even have dental at all, or they might only do cleanings and offer a dental, say $54 a month, we'll give you $1,500. So pay $600 a year, we'll give you $1,500 in dental. Which he's alluding to is one plan has $2,500 of dental. And it also has $50 of over the counter. That's fantastic. But not all plans have that. And some people have dentures. People our age, a lot of us don't have our own teeth. People with dentures don't need a dental coverage. They get a realignment of their dentures every 5 years, whatever it is. So why let the plan have dental? Let me use that money, that $6,000 hole. Let's use that money for something else.
And that's what you did with us. You asked us, we gave you a list of our doctors, we did all the different things, and then you were able to show us the plans that best suited our needs. And I think it's really important for people to consider speaking to you or someone like you to do this, to make sure that, because now were people notified if Regents leaves? Did they notify people they were going to be gone, or they just don't have anything come January 1st? Surprise.
People without insurance?
Regents.
Oh, Regents. I'm sorry. I took my hearing aids out.
Okay.
No, they received an annual notification of change. That's required. The problem is most of them that I've seen are like little pamphlets made out of brown tissue paper. They look like a refrigerator warranty or something that comes in the box. People get that and go, I don't want to read all that. And they throw it out. So they're unaware that the change is coming unless a friend has told them. And I've had a lot of people go, my friend says, I'm losing my plan. Yeah, you got a letter about it. No, I never got a letter. Yeah, you did. You just didn't read it.
I think Jim is the one who read about our plan changing, and that's when we picked up the phone. Poor Kevin.
No.
Sounds like some of these companies, it didn't pan out financially for them to stay in the state when all these new provisions and requirements from Congress have come in.
And more than that, without going in, but just globally speaking, Medicare's contracts with providers did not take the expected leap this year. And some of that's pledged in the Inflation Reduction Act. There's a 1.9% max that's tied into that. It's one of the things I didn't like about it. So I won't name a company. There's one company that did 300 million a quarter. I think it was, and they were operating on less than 1% profit. And when the new contracts came out that they signed, they could see the writing on the wall. They barely survived profitability. Many companies lost hundreds of thousands a quarter this year. They're going to lose their shirts next year. So rather than do that, they just
What steps, if somebody's unclear where they stand right now, what would you suggest they do?
there are a few people, less than 1%, that are really good at research and really good with computers. A big majority of people our age, Medicare age, they're a different generation. They like their flip phone. They don't know about smartphones. They don't know about computers very well. They can do Facebook usually, but sending a picture and a text is hard. But if someone is good at studying, I recommend Medicare.gov. Now, Medicare.gov is greatly flawed. There's several plans that we are appointed to do that people have to qualify for that aren't even listed in there. And then many of the benefits are erroneously represented. Medicare.gov, but it'll get your feet wet. And so I suggest to people to do an hour worth of study. Start with Medicare.gov and plug in your zip code, plug in your doctors, and then play around in there. We'll see which providers cover your doctors, and then also your prescriptions. You should put your formulary in there. And then talk to a broker or a Medicare agent, enrollment agent, and then you'll have some knowledge. Then your questions will be, what's the difference between an HMO and PPO? Before you maybe didn't even know they existed. Your questions will be smarter. Go ahead.
No, go ahead, you finish, because my question is different.
Oh, I'm done.
Are there people they should avoid? They could call you.
Oh,
I hear a lot of advertisement on the radio and television and whatnot for number and call. You mentioned that you represent how many companies now? If they're only when you're only going to get what that one has to offer, correct?
correct. Yeah. And their incentives, the captive agents with commission and salary. Yeah, they're going to push for that. What was the first part you said, Judy?
Any other, I know you can't really name names.
Oh, we make commercials.
Or if they want to talk to an agent to help, because I could do it, but I don't want to. I read enough contracts.
Yeah.
Kevin, let me ask you, if they lose their coverage because they didn't do anything with this annual enrollment period and January 1st comes along, are they going to be penalized because they aren't enrolled in anything at that time?
They're as long as they enroll in a new plan within 63 days of their plan leaving, that will open up a window for them. But meanwhile, if they don't realize it till too late in January and it's into February, their new plan won't start till March. So that's still within a 63-day window that start March 1st. So they won't have penalties. I think that's what you're alluding to.
Right.
The 1% penalty per month. They won't have penalties for 2 months without adequate coverage.
That could be really scary.
The hospital part A, the most I've seen someone have to pay was $90,000. Their first stay in the hospital, you got to whip out $1,600. And part B, all the doctors and tests, you got to pay 20% of that. I've had 2 clients in the same year, same hospital. One was in the hospital for 3 months. One was 4 months. One paid $800,000. One paid $1 million. That's how much the bills were, not what they paid. Advantage plans, most of them have a built-in safety net. It's called maximum out of pocket. Once you hit that, it kicks in, so you don't have to pay the millions, but you still may have to pay 5 or 6, up to $9,000 of that. But no, they'll just be without coverage until they can find coverage, and they'll be motivated. But the TV, all of them, I called and I put it in my zip code to see what I would be blessed with, right? What those companies, those are national commercials, many of them. And they've taken a small county in Kansas that has a certain thing on a plan that no one else in the country has. So unless you have that zip code, you don't get that. And they're listing all those things on the TV. The other thing too, if you call, it's always a recorded call. They'll say, is this Dennis Day? Yes. You just said yes. They delete this question And now they've got you saying yes, and they can sign you up on the phone without a signature on whatever plan they want. Seniors should never be talking to salespeople on the phone, especially not Medicare. Many scams.
That's pretty scary.
So
Kevin, if people suddenly wake up on January 1st and find out I'm not covered, how do they get a hold of you?
360-355-6550 or Medicare@gmail.com. So I'm happy to talk to anybody on the phone. Judy said we don't charge anything. And if we can't get it fixed before midnight on Saturday, I'll give you instructions on what we can do for January with your plan. But I will stay up all night long. If people call and say that they're losing their plan, those are the ones I want to talk to, especially to make sure they don't go a couple months with just basic traditional A and B. Yeah.
Thank
Kevin?
you for this fantastic information, Kevin. This is really helpful. And I don't think a lot of people really know this is happening.
But you think about it. Judy, you're on Medicare. Don't you get a bunch of stuff in the mail? Don't you get phone calls? And yeah, good for you.
I'm terrible.
know,
I see it says United Healthcare and they want to have someone come to my house, and I don't want them to come to my house. So I just don't answer them.
I'm a little different because I have the capabilities of recording phone calls. I think the last one, I ended up ending the call. When it third Medicare, I said at 2:13, a recorded call with someone, and here's his agent number. Go access that recording because he didn't tell me if I picked Humana's Honor plan. Yeah, they're going to give me back on my Social Security. That's awesome. But there's no drug plan built in because I'm supposed to get my drugs through VA. And he never told me that. He never mentioned it. If people from out of state get complaints and people in state, you only get so many. And Medicare yanks your license. You can't do it anymore.
Can you operate in other states? Sell plans there?
Oregon.
Washington, Oregon.
That's enough. 2 states is enough.
They might call you, but I'm not sure you have room to help them.
Are there people you could recommend in other states?
Yeah. There was a group of 8 of us that are all over the place now that helped United Healthcare. And I don't know if that's 15 years ago or wherever it was, come to Cowlitz County. And those are solid men, good ethics and morals. They're just like me, never do anything illegal. And so, yeah, I have people in other states I can refer you to.
Good.
Thank you again, Kevin.
Well, that is a lot of valuable information.
Just send me an email, MedicareKev@gmail.com, and give me your phone number. That gives me permission to call you. Right?
Thank you again, Kevin. This has been very helpful. And we'll probably see you again next year.
And to correct Judy, this is my 3rd time on your podcast.
Right.
Yeah.
Okay. All right. Thank
Good
you,
night,
Kevin.
you guys. You're both awesome.
Bye.
Bye.
See you later.
That's it for this episode of Getting Your Edge, How to Right Size Your Home Life podcast. We're here to help. If you need to get a hold of Kevin, we can help you with that. If you need information about selling your home, buying a home, or just general information on downsizing, we've got it all. Thanks again. See you later. Bye-bye.